Visualize Visual VRP is a portable vision testing platform that includes visual fields, acuity, color vision testing, pupillometry, and extraocular motility. The visual leverages virtual reality, artificial intelligence, and augmented technologies to enable eye care providers to test for and monitor common eye diseases. Visit alleyes.com for more information. Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you.
Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with MicroMicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and MicroMicelle technology.
Welcome back to part 2 of my interview with Dr. Britney Caruso. In this episode, Dr. Caruso explains the best foods to keep your eyes healthy. If you're new here and you like our interviews, press like, subscribe, share, and hit the bell. Also, please leave comments. Be sure to watch our full-length documentary, Open Your Eyes, on Amazon Prime, Apple TV, iTunes, Google Play, and YouTube Movies and Shows. And tune into our brand new radio show Saturday mornings at 9 a.m. Central Time on AM 1280 The Patriot. So let's talk about replace, number 2. So we're removing the bad things that are damaging the single layer of the inside tube of the gut, and where that is opening up and contents are leaking through, and the body is recognizing it as a foreign substance. So if your weakness is in your joints, you could wind up with arthritis. If the weakness is in your eye, you could wind up with uveitis, where the body sees it as something foreign. So we want to remove those things that could cause the gut to open up. Now we want to replace. So what are we going to replace it with?
This is what's funny, is that it's a bacteria in the gut that help to keep the gut healthy. They help to, they basically break down substances and help to keep the gut wall intact. It's crazy. So we need those good bacteria around in order to keep the gut moving and everything intact. So when what you're going to replace is those good bacteria, and you can do that through probiotic, oral probiotic, or foods that have good bacterias and good bacteria in them. By good foods that have probiotics in them, I mean anything that's fermented, from kefir to sauerkraut to even a pickle, pickles, and then your yogurts and other foods that have excellent probiotics in them. On the replace level, I kind of talked a little bit about it in my book, but the collagen is really pretty huge in gut repair. So by taking collagen either in the form of a collagen supplement or in the form of a bone broth, you help to repair the gut wall.
And you talked a little bit about reinoculation with probiotics. How about prebiotics? What are prebiotics and why are they important?
Prebiotics are interesting. Prebiotics are the things that sort of move things along in the gut. those are, it's almost like fiber. So pretty much anything that has, any food that has fiber in it, like an apple, a pear, or even there's spinach or broccoli, cauliflower. All these foods help to keep, it's almost like that it moves things along. It's a fiber that feeds the gut wall, and it feeds the bacteria to help the bacteria function so that they're moving and doing their job.
So you talked a little bit about nightshades. What are nightshades, and are they good, they bad, or are they both?
It's kind of funny. The nightshades are a tricky one. So there are so many good things in tomatoes and in eggplant. So these are just a couple of the nightshades, peppers, bell peppers. So basically a nightshade is a vegetable that or fruit, as in the case of tomato, but it has these tiny little seeds in them, and the tiny little seeds are meant to be, they're meant to have a film or a layer around the outside of the seed that helps to protect that seed. The protection of that seed is it fends off all bad things. So when it's ingested into the body, it's meant to be recognized as foreign, and the body does recognize that seed as foreign, and it tries to attack that seed. And that attack of those tiny little seeds can result in a more global attack, such as what we see in an autoimmune disease. So those nightshade vegetables can be misunderstood by the body as foreign and can cause a bigger problem than the good things that it can possibly bring to your body, like the good things that we find in all these vegetables.
And how about cruciferous vegetables? I guess it's named after, they supposedly look like a crucifix.
Mm-hmm. Yeah. I keep on looking at my broccoli and I just don't see where they came up with this crucifix when they saw broccoli, but whatever. I just go along. I'm just telling you what I find. So cruciferous vegetables are some of the best. There aren't too many, that you almost can't get enough of those in your diet, if you ask me. The crux of the matter with cruciferous vegetables is that they truly they've been deemed anti-cancer foods. Now, whether or not they truly stop the progression of cancer is maybe debatable. I've cited some studies in my book regarding the anti-cancer effect of these vegetables, but overall, the cruciferous vegetables provide antioxidants. They provide the prebiotics that we need, and they help to protect our eyes on a global scale.
So then that would be kale, Brussels sprouts, arugula, broccoli, watercress. Those would be the cruciferous vegetables. And there's also some benefit to cardiovascular health as well.
Absolutely.
You know, in your book, you cited a couple studies of people who eat a lot of cruciferous vegetables versus people who don't, that there's a 31% reduction of risk of cardiovascular disease. Mm-hmm. And there were some studies on brain function.
Yes, the brain and the eyes, anything that you do that's going to protect your eyes is going to also help the brain, which is where I think that when we going back to the macular health, when you see a healthy macula, healthy macular pigment ocular density, in general, you're going to see a well-functioning brain.
And you make a big point about garlic.
Yes, huge.
So yeah. Talk about garlic.
The PU plants. That's what I call them in my, pretty much any allium family plant is going to be It's the power of these is just mind blowing. From antifungal to antibacterial to pretty much anti everything. Now, I'm not telling you if you have a bacterial eye infection that you should go put a little garlic in your eye and you're going to be fine. That's not what I'm saying. However, if by there's a reason why the garlic is so it's so important for, especially if, like, let's just say you're getting a cold. If you take 3 or 4 garlic cloves and you put them in a little bone broth, this can really help to stop the progression of your viral infection. So for the purposes of the Beyond Carrots plan that I lay out in my book, the garlic is going to help heal the gut by killing the bad things. It's going to help fuel the replenishing of the nutrients that you need, and it's going to help stop all the bad inflammation in your body through its powerful effects.
I think you had a very interesting study in your book about garlic, and that a daily garlic pill decreased the risk of a cold by 63%. And it lowered blood pressure equally with atenolol, which is an old-fashioned beta blocker, maybe not as good as some of the new beta blockers, not as good by the studies as some of the new beta blockers, but it was equal to atenolol in the study. So I thought that was pretty interesting. Now, you're a big proponent of bone broth. Why is bone broth important, and how could that help us?
So, there's a whole group of people that kind of discuss this idea of meal replacement, bone broth meal replacement, a liquid diet for an extended number of days, et cetera, et cetera, et cetera. I'm not in that particular family. However, I do see value in a daily dose of bone broth from the gut healing effects to the improved sleep effects, and it actually helps to it improves your skin through the collagen, and it can actually help you to lose weight naturally. It can naturally reduce weight, can cause natural weight loss. Because your body is taking in the protein without water, and it helps to promote weight loss in that fashion. So from the perspective of the Beyond Carrots plan, the main reason why we use the bone broth is to protect, first of all, increase the intake of water, if at all possible, through the water content of the bone broth. It helps the collagen will help to replace the wall of the gut and repair any areas of collagen loss throughout the body. It's an anti-inflammatory. It helps to reduce inflammation throughout the body. It will improve your sleep, and it will improve your overall weight.
I mean, you make a good point in the book about glutamine and glycine, that there's 2 amino acids that are very important in bone broth.
Those are the 2 big ones in bone broth.
And the glutamine is for the anti-inflammatory, and the glycine helps with sleep. But you talked about sleep in your book, and how sleep is an important for anti-inflammatory, and it's hard to get healthy if you don't sleep. And one of the tricks that you said I thought was very interesting is tart cherry juice, or tart cherry and almonds at night before you go to bed. That could help you sleep.
I have tart cherries and a small bowl of tart cherries and almonds almost every night, along with chamomile tea.
And that helps with sleep.
Yes.
Now let's talk about stress. How can stress affect your eyes?
Well, let's just put it this way. I have seen people come into my office literally with vision loss as a result of stress. They literally cannot see because they're under so much stress at work and in the house. So this specific condition that I'm referring to, that is most in our face when it comes to stress, is a central serous retinopathy, which is basically, it's like a bubble forms in the back part of the eyes, right in that 5 mm zone, dead center. So I'm like, it's a worse spot for a bubble to form, a water bubble to form in your eye. But this little fluid bubble starts to form there. And that it's funny because the patients come in and their vision isn't terrible. I mean, they're not running into walls. It's not like they're going to go blind and everything's going to be okay. They just need to reduce the stress in their life so that little bubble goes away. And to try to tell my patients that the reason why they can't see is because they're too stressed out. They look at me like I got 3 eyeballs. Like, how in the heck does that have anything to do with my eyes? And in my case, for instance, even in my case with my posterior uveitis, I believe my gut tells me that the reason why everything started for me in the first place, this whole thing, is because I was under a lot of stress. I was working 7 days a week. I had, I was doing very high intensity workouts. I was working well over 60 hours, and and it was continuous. I think I had 3 days off a month. You can't live life with 3 days off a month and expect to not have an eye problem or any kind of problem whatsoever. So when I saw the damage to my eyes and I started doing research on the possible causes, I put a solid halt to my work schedule and I made major changes.
I mean, there was a study in EMPA in 2018 about stress, and it showed that, of course, stress increases cortisol and may actually increase the risk of glaucoma, ischemic optic neuropathy, and diabetic retinopathy and macular degeneration. I mean, that was a study that was done that looked at a lot of different studies and put it together. So, as eye doctors, is something that we don't consider enough about, but stress is very important. Stress could affect any part of the body. Heart attacks, how often is a heart attack related to stress, or a stroke?
Diabetes, obesity, stroke.
So it's very important. And we talked about sleep before, and sleep, you had a pearl in your book about sleep. Not enough sleep or too much sleep can lead to glaucoma.
It's under 3 and over 10 hours of sleep a night, you're at a higher risk of glaucoma. So I had a patient the other day who worked night shifts and was literally only sleeping around 3 to 4 hours a night. And I'm like, I had to have a conversation with her, and I told her about her risk. It's crazy. But again, like you said, over 10 is, you have some problems there too.
And same with macular degeneration.
Mm-hmm.
That you had a study about sleep. Sleeping way too much could increase the risk of inflammation and increase the risk of macular degeneration. I thought that was an interesting thing that you had in your book. So let's talk about the workup.
So one more quick thing. It's interesting to me because I think that some people don't realize that they have control over their sleep. Because sometimes people just think, what can I do? I can't help that. It's just how my body is. It's really interesting where if you break down what you do each day and you think about what it is that you're doing each day to promote your sleep, maybe limiting caffeine after a certain hour, maybe only having 1 cup of coffee versus 5 cups of coffee. But all of these things will ultimately impact your sleep patterns, and you have control over what happens to you when you go to sleep at night.
And in your book, you have a couple of good tips about sleeping better. If maybe you could we talk about the cherries and the almonds, going to bed time every night, making, within a half hour. And you had a couple other tips in there.
Well, I mean, and I don't know if you mentioned the bone broth, having bone broth. And then it's the cool room at 69 or under, completely dark room, same time to sleep, same time to rise. And one of my favorites is getting at least an hour of direct exposure to sunlight daily. So that in particular earlier in the day helps to set your circadian rhythm so that your body knows when it's morning and when it's evening. So there is something to be said about that.
In the book, you talk about the workup you think somebody should have between the eye exam and some of the labs. If you could talk about that.
Yeah, I go into great detail regarding getting as much information prior to starting the Beyond Curate's plan as possible. From knowing your blood sugar, your weight, your waist circumference, the bowel transit time. So bowel transit time is the amount of time that something takes to go from your mouth to your butt.
Why is that important? Why is that important? What does that tell us?
If your bowel transit time is, we have an ideal time frame for for something to go from your mouth to butt. It's around 24 hours ish, 20 ish. So if things are below that time, it means that it's taking that food's getting kind of stuck in your system, and then you get a buildup of toxins. So we don't want that to happen. And if things are going through your system too quickly, that means that the nutrients aren't getting absorbed by the body. So we don't want to build up toxins, and we don't want things to go through your body so quickly that you're not getting the right amount of nutrients absorbed. So we really care a lot about how fast things are going through. And there's an easy way to do it. Just eating a couple beets and watch your poop. You'll find it sooner or later. So I go through. There's more detailed explanation of what to do in my book. But bowel transit time is pretty important. So, and then the waist circumference is a picture of your face, and then various tests in the optometry office, like your contrast sensitivity and your actual vision, along with any kind of ultrasound of the back part of the eye that may be available, and if at all possible, the macular pigment ocular density. So there's a number of tests that we talked about in the eye exam, during the eye exam that we want to get documented. And along with your prescription. So the reason why we care about this information is because as you improve your diet, as you make the changes that are laid out in the Beyond Curate's plan, you can see a change in any number of these areas. The contrast sensitivity is probably the most well documented and the easiest to perform if your doctor has the contrast sensitivity ability to do that test. So the score gives us an idea as to how well basically you can see a very faint contrast, a very fine contrast, and dark to light contrast. So you'd see a very various scales of a light to dark numbers on a piece of paper or on a computer screen or whatever it is that the doctor is using to measure the contrast sensitivity, and we get a number. As you go through the Beyond Curate's plan, it is our theory that number would actually improve or decrease.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
The All Eyes Visual VRP is a portable vision testing platform that includes visual fields, acuity, color vision testing, pupillometry, and extraocular motility. The visual leverages virtual reality, artificial intelligence, and augmented technologies to enable eye care providers to test for and monitor common eye diseases. Visit alleyes.com for more information. And I think it's interesting about waist circumference because it's directly related to all-cause mortality. So as that belly gets bigger, and you have a big belly, the chances of dying goes up quite a bit, and it also increases the risk of macular degeneration if you're overweight and you have a high BMI. I mean, the Beaver Dam study showed that pretty clearly.
Exactly. We also do a perceived stress test score, and this is a standardized, a very short, easy stress test to get a number, a numerical value as to how stressed you are. The reason why I like this test is because it's standardized, it's easy, and it's repeatable. So we get a number there, and we don't know. Maybe at the end of the 30 days of going through the plan, your stress may be lower. But the reason, one of the interesting things that I talk about when we talk about all these, the plethora of tests that we do prior to starting the Beyond Carrots plan, is that we really, I really don't know what kind of impact the plan is going to have on each individual person. And I don't know what kind of impact it's going to have from if you were to do the plan in January versus what happens if you were to do the plan in June on the same person. So all I know is that if you follow the plan, I almost 100% guarantee there will be an impact, a positive impact in one or more areas of the testing that is done prior to starting the plan.
Okay, let's go over some of the key things in the plan. So what should we eat? Let's start with protein: grass-fed beef, grass-fed pork, poultry, wild-caught fish. What are some of the benefits of that as opposed to eating like the SAD diet, the standard American diet?
Everything that's listed in my protein list feed the body the nutrients that it needs to replenish itself, versus the SAD diet, which are majority of those foods are processed and have inflammatory components.
So, some people say you should be vegetarian, pescatarian, paleo. How do we know what's best? Are they just fads, or is a vegan diet, does it really work for some people? I mean, because you kind of run out of things to eat, you wind up starting to eat Twinkies.
That the I briefly talk about the alphabet soup of diets in my book. There are good things and bad things to each of those diet plans. I don't want to condemn someone for necessarily going vegan, and nor do I think that that's the best, nor do I want that as a lifestyle for myself. Likewise, being gluten-free versus eating a ton of gluten being gluten-free can be good and it can be bad. What's most important when you break down all this alphabet soup of diets is that you're eating whole, nutritious foods that feed the body the nutrients that it needs in the wholest, most pure form that you can find it, in my opinion. And again, everybody is going to have their opinion. Being a doctor is just a bunch of good opinions put into a soup, and hopefully everybody can take what they want to take and leave what they don't.
Talk about the different oils, whether we have omega-3s, avocado, olive oil. Talk about that and what you're feeling on those.
There are some oils. The oils again are a little bit tricky. So olive oil is great. I don't think I went into too much detail about this in my book. Olive oil is great. We know it has a lot of omega-3s. It has it's actually healing and gut healing, but it's tricky because some of the good components of olive oil are broken down when heated. So olive oil is best when it's in the most pure form, and it's hard to find the purest form of the olive oil. And when not heated. So if you're going to put on a salad, you're great to use the olive oil. When cooking, you're oftentimes better using something like a coconut oil, where it's actually it's almost like a white paste, but then when you cook with it, it breaks down, and it's actually you have the MCTs, and medium chain triglycerides, and coconut oil that help to feed your brain and actually repair the body.
And we want a high smoke point when we're cooking, because once it starts boiling, then it could become a little bit carcinogenic.
Right. And that's where it gets a little bit tricky with the oils. And coconut oil, we know, is one of those oils that does have the highest smoke point, and it's completely it's excellent in its cooked form.
And talk about the colorful vegetables. We talked a little bit about it before, but why is it important to eat different colors from the rainbow?
Pretty much every food that has different colors. I mean, I'm going to very much simplify it for you. There are good things that spinach has in it that, say, a blueberry doesn't. There are good things that a blueberry has in it that spinach doesn't. But when you eat foods that are of every color of the rainbow, you're going to get everything that you need in your diet that your body wants and craves.
And you, in your book, you talk about Mother Earth's desserts.
Oh, yum.
So
those are my favorites.
So everybody wants something sweet once in a while, and they want a little bit of a dessert. Tell us what Mother Earth's desserts are.
So my son is a king of Mother Earth's desserts. He will decline chocolate. He will decline a Snickers bar. He'll decline any kind of Skittles. And when I hand him an orange or a blueberry, he'll grab it and run. So the Mother Earth's desserts is pretty much any kind of fruit that you can find. And even some vegetables can be served as part of your dessert. I actually like to sometimes I'll make a vegetable, fruit, and nut platter in the evening, and I'll just nibble on that but before I go to bed. So these are the things that if you can train your brain to appreciate the complexity of these fruits, then I think that you're going to find that you actually really very much enjoy them, and you're feeding your body the good things that you need. And one more point on that is oftentimes even a fruity herbal tea can serve the purpose of giving yourself the feeling it's like it's having a dessert without actually going in and indulging in the cookies and the toxic things that do not serve your body, but rather kill it.
Well, since you brought it up, cacao, raw cacao, or high, like 88% chocolate.
Yeah, well, that's a whole nother.
Is there any benefit to that in your opinion?
Yes. Truly anti-inflammatory, and a key part of a diet if you're ever craving that little bit of a chocolate, and it's actually excellent for brain health. So yeah, cacao is an exception.
Dark chocolate and
cacao.
How about coffee? You write a lot about coffee in your book. There's the pros and cons of coffee. I mean, everybody drinks coffee other than me. I don't drink coffee, but almost everybody in the country drinks coffee. So
too much of a good thing is never a good thing. So coffee is excellent for you for a number of reasons, so long as it's black without all the added junk in it. As soon as you start adding cream and sugar and 5 Splendas and all sorts of other stuff, you're killing the natural goodness of the coffee. That being said, when you drink coffee, is, as we all know, most coffee, as long as it's not decaffeinated, has caffeine in it. Even decaffeinated coffee has a small fraction of caffeine in it. And later in the day can kill your sleep cycle. So it's and coffee at a higher levels, there is some debate as to whether or not it can do damage to your gut wall. So there's a fine line to how much coffee to drink. For the purposes of my plan, it's difficult to just say stop drinking coffee. This is bad for you, or it's not bad for you, but stop drinking coffee and only limit yourself to 1 cup of coffee per day, which is what I think is really where we need to be, is at somewhere around a cup of coffee per day. When you get into 3, 4, 5 cups of coffee, you're gonna have some problems. At 1 cup of coffee per day, if someone is coming off from 5 and you're telling them to go to 1, they're gonna have some withdrawal symptoms. So I usually say cut it in your cup of coffee in half, and then cut it in half again to where you're at around 1 cup of coffee per day.
I think one of the issues with coffee, they spray coffee with a lot of pesticides.
Oh, for sure.
So you're getting a lot of toxins and chemicals if you're not drinking organic coffee.
Yeah, I usually buy the organic stuff, but
And some people could raise their blood pressure, and some people genetically could process coffee very quickly, and other people, they can't break it down in their body because of genetics.
so that's where 1 cup of coffee or even a half cup of coffee, you get some of the goodness without overdoing it.
So we talked a lot about inflammation. Spices are very anti-inflammatory, and that's part of your plan.
Most spices, cayenne pepper and paprika, are interestingly both in the nightshade category, along with, of course, red pepper. So, but those spices, we are really got to be careful with those, for the purposes of reducing inflammation in the Beyond Cures plan. But most other spices, many of them originate in India, from cumin to turmeric and curry, and all of these spices do an amazing job at reducing inflammation and providing flavor where you may not have been able to appreciate those flavors in the past.
I just saw a study this morning on curcumin and pancreatic cancer. That could be some benefit there, especially the type of curcumin that is that it's easily absorbed, so that has good bioavailability. And I thought, that was pretty interesting. I mean, obviously that's something people would need to look into further, but curcumin is a very important spice, and there's been studies on curcumin, how it decreases pain equally with NSAIDs. So curcumin could be used very effectively. It's used very effectively. It's used as a staple in India, and it's often said that it's one of the reasons they have a decrease in Alzheimer's. I was wondering if you could comment anything you could add to that on curcumin.
I think you pretty much nailed it on the head. It's interesting. The one thing that I would say when it comes to those spices is that the bioavailability is a little bit funky. Really and truly, to make a true impact on your inflammation level with a spice like that, you would need a lot of that spice in order to really see an impact long term. So oftentimes you'll see the pills, they actually have, like, the supplements that are for various spices, and those are sometimes bioavailable. They have higher bioavailability. Again, it's kind of debatable.
I think in the study that I'm talking about, they used a liposomal form.
Mhm.
I think something like curcumin isn't
Right.
absorbed very well, so a lot of times they'll package it with oil, the good companies, to try
Mhm.
to get you to be able to absorb it a little bit better. And you talk about your warm fuzzy drinks. We talked a little bit about bone broth. You did mention chamomile tea that may be helpful for sleep,
Mhm.
or chai tea, green tea. Any comment on that?
No, I mean, I really just starting to appreciate your, I mean, tea time, and sometimes if you don't appreciate the actual tea bags when you see a loose leaf tea, I'm just introducing the ideas to our listeners that a loose leaf tea kind of adds an extra layer of complexity to your tea and makes everything just a little more interesting and a little more flavorful.
And you have a whole list of how to eat certain foods, like eating a minimum of one serving of fish daily. Anything offhand that from that list that you could remember after being pounded by all these questions for the last hour or so, that you could bring out to the
I,
audience?
I mean, a serving of a minimum of 1 servings of fish per day, minimum of two servings of meat per day. Make sure you have the bone broth. Sometimes people get overwhelmed by the idea of bone broth daily because they don't want to sip a bone broth. Although I enjoy it, not everybody enjoys it quite as much as me. You can cook with the bone broth, and by cooking with the bone broth, you're still getting the added benefits without having to actually take it in by mouth as a drink. Minimum of 64 ounces of water per day. This is just a bare minimum. Most people need more. So I say that is very sternly. Make sure you're drinking as much water as humanly possible. As much green leafy
Not all
vegetables.
at one time. Not all at one time.
Yeah, all in the morning at 8 a.m. Make sure you get 100 ounces of water in at 8 a.m. No, I'm
Good.
just
I don't want you to drive.
kidding. No, as many green leafy vegetables as humanly possible. The PU plants, a couple PU plants per day. I mean, it really, if you follow those basic guidelines along with some stress relief time, 10 minutes of stress relief minimum per day. And one concept that I don't think I clearly illustrated in the book, was taking time for yourself. Taking 1 day per week, minimum of 1 day or one night per week to have you time.
And this question always comes up. It comes up to every speaker. Uh, Eating healthy is more expensive. Is there a way to eat healthy and not being so expensive?
Yes. I mean, I personally get most my freezer is like where I keep a lot of stuff, and I individually package things when I find them at lower prices, and freeze pack them and keep them in my freezer. So by finding good quality chicken when it's on sale, you can even frozen vegetables. Frozen vegetables have many of the same nutrients that fresh vegetables have, and they're cheaper and easier and faster. For me in my lifestyle, I'm moving at a million and 1 miles per hour. I need everything to be fast. So there's no harm in grabbing some frozen vegetables that are organic and easily cooked when you need them, and they're not expensive. As far as your bone broth goes, it's just you if you just take a bunch of bones and throw them in a pot and let it boil, boom, there's your bone broth. I mean, if you make a steak, you're gonna have an extra bone or two left over from a T-bone steak. There's your bone broth. So it's you being more creative and even growing vegetables. If it's too expensive to buy your herbs, grow your herbs. And it's kind of fun to grow herbs if you don't kill them.
I did a podcast with Austin Perlmutter, and he talked a lot about the power of nature. And I saw you had that in your book, how being out in nature is very important for your health.
It's called earthing. There's actually a name for it, or grounding. And there's I've done some studying of the concept or the impact of actually letting your skin kind of resettle with the electric waves of the earth. And it's actually the earth actually has a certain electromagnetic waves going around it. And when you let your body connect with the electromagnetic waves of the earth through the grounding and earthing, it's actually it's healing.
And you talked about it for yourself. You thought maybe you were over exercising, and people can over exercise. And we've seen that with marathon runners getting heart problems. What do you think is the right amount to exercise for somebody who's reading your book and is trying to reduce some reversal or prevention of whether it's an eye disease or a systemic disease?
So the right amount is ambiguous because everybody's different. So the right amount is the right amount for you. So in
What's the
general,
right amount for me?
so in general, I think that most people try. Some people like to push themselves, say to 90% of max of what they're like that. I can't do one bit more, and then now you're pushing yourself almost to the actual limit. Some people like to be at somewhere around 20% of the max. They almost don't want to do anything. So what I would suggest is that you push yourself just a little bit more than doing nothing, but not all the way to 90%. So for most people who are reading the book, I'd say go about just a little bit harder than what you're doing now, and actually watch your heart rate get a little bit higher than where it is right now for around 150 minutes per week.
And meditation, you talk about meditation. How do you meditate, and how important is it?
My meditation practice ranges anywhere from me sitting on my sofa for 10 minutes in the morning to me just chilling out in the shower or bathtub for an extra 5 or 10 minutes. So there's no, for me, I routinely add my 10 minutes in the morning, but any additional meditation throughout the day can come in little spurts. So I think that the 1 to 2 minutes on occasion that I get throughout the day of my being mindful is what really it's helpful. So meditation and mindfulness kind of go hand in hand. Meditation is as what most people would classify as the act of actually sitting and actually making an event of it, whereas mindfulness is the concept of living in your moment and being aware of where you are at that moment throughout the course of the day, enjoying your food, enjoying the smells, enjoying the environment. So there's two different concepts, very big concepts, and to summarize, the breathing techniques, the mindfulness techniques, and the meditation techniques help to heal every bit of your body, reduce your high blood pressure, reduce inflammation, and actually and acts as an anti-aging component to the book.
So we covered a lot of ground in your book, and as we finish up, I do want to ask you, what can you help people to get them motivated to get started? And once they get started with the program, what can they do to continue to keep going with the program?
The motivation has to come from within you, from within the person who's reading the book. So when you stop and say, I am super happy with my life because of X, Y, and Z, and I see X, Y, and Z for my future, and this is where I want to be. So if you can visualize an amazing future and know that by putting your work forward and putting in just a little effort, you will feel better in the future by executing the steps of the plan. That's what I think to be empowering for the reader. So knowing that you can make changes and knowing that changes will make you feel better. That's that's moving, that's empowering. And everyone's motivation is going to be slightly different. But the interesting thing is that the Beyond Curates plan can help shape and change so many aspects of your life beyond just the eye health. So that's really important, and I think that's that whatever goal you're looking for, we can help you achieve those goals.
Well, I want to thank Dr. Britney Caruso for joining me today. If people want to get your book or find out more about you, how can they do that?
Check out my website, drbritneycaruso.com. That's Dr. Britney Caruso, CARUSO.com.
And they can buy the book from the website.
Absolutely.
Well, I want to thank you for joining me today. You're a wealth of knowledge, and I'm really happy that you're doing so well with your eyes, and that thank God you could see me and do this podcast. I'm really very happy for you, and happy that you're able to share this great information with my audience. So open your eyes. This is Dr. Kerry Gelb, and thank you to Dr. Caruso. The All Eyes Visual VRP is a portable vision testing platform that includes visual fields, acuity, color vision testing, pupillometry, and extraocular motility. The visual leverages virtual reality, artificial intelligence, and augmented technologies to enable eye care providers to test for and monitor common eye diseases. Visit alleyes.com for more information.
Your eyes and your vision are under attack, damaging blue light from the sun. Your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Fitting multifocal contact lenses presents a big opportunity to meet patient needs while growing your practice. Alcon is your partner not only with our innovative portfolio, but through e-learning. Learn to enhance your multifocal strategy today with the Alcon Experience Academy.
OIE Broadcasting is the emerging leader in social media. We use scientific entertainment to drive more patients into your office. Visit oiebroadcasting.com and sign up today.
Since I bought Safe For You, my dad makes me clean his boat.
Es natural y es un buen producto.
Every time I go back to school, my mom always makes sure that I have my Safe For You products. I bring extra, and my roommates certainly don't mind.
It's a good thing I had Safe For You to clean up after this little guy.
When my hands get dry, I like to wash them with Safe For You.
And most importantly, the reason why I buy Safe For You is because it's safe for me and you.